to write this book because we've got, and then Chris will join us soon, Bioinformatics with Python Cookbook, Tiago Antau. And let me just introduce you to him. Tiago is a informatician. I don't even know how to pronounce this. I have no idea how you actually do your job. Who is currently working in the field of genomics, a former computer scientist. Tiago moved into computational biology with a master's in bioinformatics and faculty of sciences at University of Porto, Portugal, and a PhD on the spread of drug-resistant malaria from the Liverpool School of Tropical Medicine. Post his doctoral, Tiago worked with human databases at the University of Cambridge and with mosquito whole genome sequencing data at the University of Oxford before helping to set up the bioinformatics infrastructure at the University of Montana. That's very impressive. We can talk a lot about that. He currently works as a data engineer in biotech in Boston and is one of the co-authors of BioPython, a major uh, bioinformatics package written in Python. So, wow. And Chris, you just joining us. So, Tiago's introduction is super impressive biography. What made you write the first edition? I know this is the third edition, but what made you want to write the first edition?
So the book is mostly targeted to biologists that want to do advanced computational biology, and there is a complete lack of documentation on that space. So lots of people that want to do data analysis, they can do. There are books that teach you basic Python. There are books that teach you the scientific part, but there are actually no other books really that talk about how to solve computational biology problems very practically. You can, implement. Uh, there is stuff like doing alignments, and which is essentially standard bioinformatics. But if you want to actually analyze data with many purposes, varying from from evolutionary biology to medicine, there is actually not many books, irrespective of they are called bioinformatics or whatever. No, don't get me wrong. So some of them are actually real bioinformatics books that tell you the algorithms, and that's perfectly valid. But the approach here is to solve practical computational biology problems, which essentially there is nothing else. And I thought I should actually help biologists.
Yeah, and
Biology
you
problems.
wrote 360 pages on this thing. I mean,
Well,
this is unbelievable.
sorry, Dan. Nice to meet you, Tiago. Sorry, I
Great.
was a couple minutes late. Are you recording already, Dan?
Yeah, that's how we roll. We just record.
Okay, so I have a
Chris
question.
the amateur, guys. Chris and
So-
Dan show. Like, subscribe, comment, share.
So I have a question. Computational biology. Can you explain that to us laymen that have
Yeah,
no
I
idea
was
what
gonna
you're talking
say.
about?
Dr. Antau, we don't deserve people like you on our show. We just mess around, talk a little bit science, and then we listen to some music too, which we'll have you do towards the end. I'll prepare you now. But yeah, Chris, I'm right there with you, man. Like, I just didn't know how to introduce him, so I just started recording because it's there's
Fair
nothing
enough.
else you can do.
So there are several perspectives you can take on this. My perspective is try to solve a real biological problems. So it can be things like finding which genes are involved in drug resistance, for example, or which genes are involved in diseases, which proteins are involved in health problems and so on and so forth. Of course, the approach here is through computers, and it's mostly through getting genomics data.
So would computational biology be utilized in trying to find cures for say, cancer, diabetes, any type of disease?
It is. So one of the things that goes more into statistical genomics is, for example, to sequence lots of, so to get the genomes of many, many individuals, separate, say, them in two groups. So, for instance, somebody that has a cancer of something and somebody that a control group that doesn't have, and then to do the statistical analysis, genome-wide association studies, where you take two groups and see and try to find signals in the genome that are involved in a disease.
What do
There's
you
a
think
lot
of
of work being done
the
on the pharmaceutical side.
well, let's bring this on like a high level because like most of our audience is they like music with the beats and they like to move their feet. Dr. Antau, Google's AI that can predict protein folding, is this a similar problem that your book covers as well, like similar topics?
Not exactly. You do have things about visualizing proteins,
Mhm.
but protein folding, the algorithms itself are something that people that implement it do it, but that's more on the biochemistry side than on the biological side. So AlphaFold, I think you are talking about that.
AlphaFold, there you go. Yeah.
So that's more on the computational biochemistry side.
Hmm.
So in our case, or in the case of this book, we are we do have protein visualization, but that's just a chapter. Most of it goes around genetics and genomics.
Well,
So,
you're way above our pay grade. Go ahead, Chris.
just to say the least. So you had, I believe you had mentioned a few moments ago that primarily computational uh, biology is done with computers, correct? Is that what you said?
Mhm.
So your book, I assume, explains this in long form, right? So a computer is going to help you compute whatever you're computing very quickly, right? So I assume your book is explaining how to do this without a computer.
Oh no! So the book is targeted for an advanced audience. So for people that are doing, say, research in biotech companies, or even in places like it varies a lot. But let's concentrate on biotech companies. So these are the target is people that know the biology, know a little bit of programming, but and now have lots and lots of data and want to be able to look at that data and try to find, for example, what genes are involved in
Okay.
say, a disease, for
Okay.
example.
Yeah, that makes sense. That makes sense. Um, so I would okay. So another question about utilizing computers. So I assume prior to the use of computers for, I assume computational biology was done prior to computers. I assume it took to analyze this data maybe years, whereas now it can be done in minutes.
You wouldn't be able to analyze this data really because the data generation that you have recently, these methods would not be doable without a computer. So we are talking about hundreds of millions of data points. So
Okay.
this is a completely new approach, new in the sense that exists in the last 10, 15 years.
So computational biology is basically a new science.
Yes, it depends on where you put the definition of new, but 20 years,
Okay. Makes
10
sense.
years really.
Sure, the advancements of computers have made this realistic.
Hmm.
Do you do you ever envision well, okay, let's talk about next generation sequencing a little bit. Um to lay people, that just work in the research, clinical research, but not on the science side, just on the operations side. What's the significance of this?
So this is actually what, for example, if you are talking about the clinical trials, This is actually what allows you to find which genes might be involved in a certain disease, and with that you can find you can think about drugs that target those genes or those gene networks, and so when you are designing a drug, you essentially know which genes to target, and that allows you and that allows you to narrow down from 20,000 genes to 5, 6, 8, 9, 10, which ones might be involved in a certain problem, in a certain disease normally.
I could see how this computational biology would allow you to repurpose drugs too. So you already have a drug on the market, you know how it affects different genes, and then you're analyzing some data set for a certain disease,
Mm-hmm.
and you would find that this drug may work for this disease that's
Yeah.
already on the market, correct?
Yes. So, but I think that raises other problems that have to do with. So yes, but as you probably know, many drugs have their patents last for 10, 15 years, all depends. And if the drugs are older, it's difficult to find the fund because they are out of patent. They are difficult. It's difficult to fund clinical trials because the drugs are out of patent.
Yeah, so you make some sort of alteration to the compound, and there you go.
Yes. Yeah.
Yep.
Yes. Exactly. Yes. You can do that approach, or if the drug is still in patent, then you are fine. But yes, you can change the compound.
Right.
So I'm curious, do, let's say, small biotech companies,
Hmm.
do they hire their own people that do this, or do they contract with companies that provide this kind of?
No, they do this internally normally. The cases that I know, they do this internally. Yes.
And what's the advantage? I guess it's because if you discover something, it becomes intellectual property and it's yours, or
Yes, and the level of expertise that you need, it's difficult to contract out because you need several things at the same time. So you need the computational
Mhm.
space, you need statistics, and you also need to have domain to have domain knowledge about, say, if you work on cancer, you need to understand the cancer biology, and you need everything. So this is normally done internally, and currently there are many companies that do this internally.
How does one become what you are? Like how did you start with this? You didn't graduate high school and say this is what I want to do, or what? Like how did this?
No. So my I don't think my route is the best one because I know I started. I am currently a data engineer, but I was a scientist in the past, and before that, a software engineer. But the most common path is somebody that is a biologist and then learns how to program.
Mm.
If somebody is starting, I would strongly recommend not to buy my book.
Not to buy it. That's good. Don't
Yes,
buy it, guys.
yes. So I would, if generally you are a most people tend to be biologists. So the first thing that they should do is to either learn Python or R, which are the two biggest um, programming frameworks in this space.
That's gonna
Python
be
is
Chris. He's
growing.
gonna do that next.
Sorry.
Chris will do that next for you.
No, Chris will not be doing that.
So, but learn how to code first if you're a biologist, because the majority of people that are gonna be watching this, well, this one's gonna get diverse group, but many from biotech industry. So,
Mhm.
if you're a biologist, learn coding first before you even begin to touch Dr. Antau's books, or you won't even understand table of contents.
So
You should understand. So you should understand the middle because you should understand either phylogenetics or proteomics
Hmm.
or population genetics or genomics. But you need to understand basic Python in the case. So you need to get an introductory book about Python,
Wow.
start learning to program in Python, do some stuff by yourself, getting comfortable cloud infrastructure or Linux or something like that. And after you understand a bit of Python, and you already know you are either a geneticist or something like that, then you can pick the book. But you need both pieces before you go a bit up, because this is not there. So there are lots of tutorials and good books on introductory Python. So I didn't want to write yet another one. So I'm assuming that you already, and people that did it way better than myself could do ever. So I'm assuming that you know basic Python. You have a biological problem that you want to solve in the field of genomics, genetics, whatever. And if that is the case, then my content is appropriate, which is intermediate to advanced.
So in regards to Python, the Python language, what is the easiest transferable language? Probably Java?
So this would sound strange, but I would say Python. So nowadays the two most used languages are probably Java and Python in the whole world in terms of programming. So Python itself is massive. I would so it's bigger currently in terms of the programming, the number of people programming, I think, than Java.
Really?
It's like first or second language. So I wouldn't. You can transfer. In the past you could transfer from Perl. You can transfer from Java. But I would say I would say almost any language. Python is one of the biggest ones. So in this space there are two languages, which is Python and R.
Uh-huh.
R is a statistical language, but it's also a generic purpose language in a sense, and it's a very good language. And in this space, there are those are the big ones. But in terms of a generic programming language, Python is comparable to Java. So I would not even. It's difficult to me to say transfer from there.
So just because I'm curious, I'm going to go off on a tangent a little bit. Is C and C++, is that obsolete now? Is that not being...
No, not at all. So not on this book, but in other books. So Python is an interpreted language. It is a high-level programming language, which means that, and we are in a space of big data, lots of data, which means that in terms of performance, it's not comparable with a low-level programming language like C or C++. So for 99% of your needs, Python or R in the biological space will take care of everything. But if you need to do extremely efficient code, you need to go to a low-level language,
C,
Rust, Cython, which is a Python that compiles to C, and then you can link to Python. So there is absolutely space for other languages. And if you go up sometimes, so if you are doing research and sometimes you need to connect Python with statistical libraries from R, but that's in the opposite direction. And actually the book covers that. So it talks a bit how to interface it with R, because they are the two big languages here.
Now, I did a little reading on Python, not a lot, a little. And where it's similar to Java, I believe it has a method library like Java does, correct?
So the library in this space is substantially bigger than for Java. So you have substantially more libraries for scientific computing, for charting, for reading and converting data. I would say that, and it's a much easier language. It's much easier to use. So in a sense, I would compare Java with C in terms of efficiency and in terms of being a systems language. But if you want to do data analysis, or you want to use a higher level, a more declarative language like Python or R or something like that. So in a sense, Java, compares with C in terms of performance. And I don't see in this space you find some tools implemented in Java. So, for example, the most widely used sequencer genotype caller, it's GATK, which is implemented in Java, but most people are not going to do that. They are going to use it, and you can from Python call it, for example. If you want to implement algorithms, which is not another group of people that should not buy my book, is somebody who is trying to implement low-level algorithms. If you want to implement low-level algorithms, then C, Rust, Java are probably the language that you want to do. If you want to do gluing, if you want to do plotting, if you want to do data analysis, then it's either Python or R.
So, from your previous recommendation, it sounds as though Python's relatively easy to learn.
Yes.
How long would, say, somebody with a degree in biology, how long would it take for them to be sufficient enough to program the data set or the language to handle a data set? How long would it take for them to learn how to program in Python to handle whatever data set they're working with? Is it a 6-month kind of thing, or a couple of years?
To solve some problems, I would say a few months.
Wow, really interesting. Okay.
Yes, but of course, so Python and many languages are actually linear. So I would say that in a few months you'd be able to solve some basic problems. Of course, if you need to solve something that needs massive use of clusters of the cloud, etc., then you have to learn more and more and more. And I would strongly recommend people to have a mentality of, okay, this will take time. But if you really need just to solve one or two problems, a few months is enough. My recommendation is take it slowly. Don't, if you have time and if you like it, I think that's very important. If you don't like it, okay, but if you like it, waste your time. It's time well wasted, but you can, if you just have a problem to solve and you actually do like a little bit of programming, it can be linear. The documentation is what you have on the web is really, really good. So you a few months and you'll be doing some interesting stuff.
All right.
I bet. I mean, the more I listen to you guys talk, and Chris is definitely a nerding out on this, the more I think, you know what, all this computation and engineering genomes and all these tools are to basically improve ourselves, right? And programming essentially. Like, I just am more convinced, Chris, that we are living in a matrix. Like, more, this just convinces me more. What are your thoughts on this, Dr. Antao? To take a sharp detour really quick. What if there's a Dr. Antao 100 times more advanced that's playing with this stuff on a little mini world, Like, it's not far-fetched.
I would say I don't know, but I would say if you are interested in clinical trials, all this complicated computational stuff happens upstream, right? So you will be informed by all this computer stuff, all this matrix stuff, but the work on clinical trials is downstream from this. So it's more down to earth stuff. This happens on the science, the art science side. It will give you the molecules to be tested, and which will then go to the clinical trials.
The perfect political answer. I like it. The perfect politician's answer, right? He didn't answer your question, which I don't know if I would answer either. But he didn't answer your question, but he gave it an answer in regards to research.
Just the more I hear smart people like Dr. Antao talk about this, the more I'm convinced there's got to be. I mean, do you think coding is universal language?
No.
Oh, Huh.
Yeah.
I think coding is very good for some things. It's overrated. Many
Overrated.
others.
Jeez. I
And
don't
I
know.
would,
That puts me in a further dilemma on my thoughts here, but wow. Um,
well, you want to really go down a rabbit hole. So where do you think we're at with artificial intelligence in terms of computer programming? I think we're nowhere near it.
Yes,
Personally,
I
true
agree.
artificial intelligence, we're 50 years away at least.
Yes, I totally agree. There is more hype than reality.
mm,
All they can do at this point is program a search engine basically to go look for terms and methods that have been used for a problem before and implement those themselves. But it's not
Exactly. Yes.
it's not true learning.
Yes, and crash cars against trees and stuff like that.
Yeah.
but don't you think that 1 + 1 can equal 3 when we combine biology with computers? I mean, those two fields have been kind of growing independently. It hasn't been until very recently, maybe just right now, that they've been merged to create similar outcomes.
I think we will need to wait a few years to understand how things go.
Hmm.
So much of the, for instance, in the biotech space, much of the work in artificial intelligence, machine learning, it's interesting, but I think we will need to wait many years to see. I think we are still a bit before that. We are still processing data, cleaning data, and until we can get to the next stage, all this needs to mature.
Hmm. Yeah, I'm just thinking about things like Neuralink with Elon Musk, where at some point you could put chip in your brain. It's already has clinical applications, but what about how it when everybody gets one, you can communicate. I mean, we can consume this whole podcast in like a second, without even for like talking, just mentally. I think Dr. Antal. I mean, do you think that's more than 50 years away for sure?
I like science fiction. Um, I like science fiction. So, but
But your book would
I'm
have
pretty
been
bad.
science fiction. Your book would have been science fiction 100 years ago.
20 years ago to a degree
20, yeah.
20 years
before computers.
ago, I think it would be understandable. And that's why, if you say 100 years or 100 years in the future, maybe. But I think, I think many of these things are more hype than reality. At
More
least for now,
pragmatic.
maybe our grandkids will have a different opinion, but before that, we'll be dead.
I think we can all agree on Elon Musk is right about one thing. Once there is true artificial intelligence, it could be trouble for all of us humanoids, anyhow.
Yeah, I guess so, but I'm not worried at this stage with
No, I'm not worried either because we're a ways away.
Yes, exactly.
Once it's there, it could be problematic.
Could
Yes.
be. Who knows?
Yes.
Maybe we evolve as well and get smarter. Dr. Antal, your LinkedIn says knowledge is only potential power. Can you explain this?
Uh, I can explain that that's somewhere in the University of Montana. But I think with everything, if you don't develop things, there is some hard work to be done, even if you know something, and if you don't put it to practice, then it's sometimes worse than not knowing it, I would say.
Yeah, I like that.
Yeah, because you could drive yourself crazy and still not have any outcome you want you wanted. Unreal. Chris, any more questions? The book, like I know we started with why you wrote it, but do you think you'll write another book? You said you don't want to do one more simple because there's already exists like good books on Python. But what about another book that you think should be
I have
written?
actually another book coming out on the other extreme, which is called Fast Python from another publisher,
Hmm.
and it sits on the other extreme. So very advanced concepts for people that want to do performant Python, and it's not related to biology. It's essentially efficient Python and efficient data science and efficient data engineering.
How many people with this combined skill sets that you have do you think exist?
They are growing, so the group is growing. Um, the market has a need, a very serious need.
Hmm.
There is a big lack of people that combine the biological part and especially the software development part.
So who is the market? Is it universities? Is it, you think, drug companies, biotech? Who is the market?
Exactly the three of those fundamentally drug companies, biotech companies, a little bit, not much universities, the government in the US also.
Mm.
For instance, everything related to conservation, genetics, for example.
That's a
Where,
topic we love on this channel's government. I totally forgot about that stakeholder. Rather large one.
exactly. So, of course, you have other stuff like the FDA and CDC. So, I would imagine that a good part of the NIH and CDC, actually, many databases are provided by them. So, the NIH provides many of the databases, and that's something I cover in the book. So,
But are they actually useful? Like they're actually good?
yes,
What they
yes,
okay.
yes, they are
Yeah.
good.
For everyone that says government can't do things efficiently, there you go. Dr. Antao says they can.
Okay, we could change that to most things.
Most Do you agree with that, Dr. Antao?
I just comment on what I know, and I would say 80% of the databases that I use from the U.S. government are very good.
Hmm.
20% I would like them to be better.
Okay. That's impressive to hear. That's actually positive, optimistic on my end that NIH is actually doing something worthwhile because they've been criticized for their lack of innovation and their inability to be efficient. And it's positive to hear from someone like you that that's not the case necessarily.
I think there are many dimensions. They are a ginormous organization, right?
Hmm.
They are a ginormous organization, and there are things that, as with any big organization, that work very well, others not as well. In the context of this book, I think I have no problems on being reliable on those databases.
There you go, Chris. Government's not so bad after all. Chris Sauber. We're
Mm.
two libertarians, but yeah, this is good. This is why we have these kind of interviews as well. Not just to learn about how much we don't know, but to get other opinions on the show as well.
But my suggestion is go ahead and try to use them and form your own opinion.
Yeah,
Yeah,
uh,
certainly.
absolutely. Where do you think the biggest growth area of this, like, what's going to be the biggest driver of? Because a lot of people might be watching and say, "Wow, well, this seems like it's blowing up. Like, it's like a boom industry. How do I get into it? What's driving that? Like, who is it? CRISPR technologies? Is it like what is it?"
So just to tag on to what Dan's saying there, I would say CRISPR and mRNA are both probably going to be huge for something like this. No, new technologies that you can implement in many different ways into many different diseases.
Yes, so those are two good examples. I would so currently the big bottleneck is sequencing technologies, because sequencing technologies generate a lot of data of low quality, and we spend 90% of our time cleaning up data. So what I would like to see, and I think it will happen in the next 10, 20 years, is that we'll see technologies, sequencing technologies that produce substantially less data of higher quality, which means
Mm.
that in 10 years or so, the in 10 years or so, I would expect that we spend less time curating data and more time actually solving problems.
Hmm.
Yeah,
A
that
lot of
makes sense.
So if you look, for example, to my book, there are the first two chapters and the last two are actually related with doing it with lots of data and how to clean it up. But I would expect in 10 years that these chapters won't make any sense anymore, because we have, instead of having short read sequencing, which what we have now, which generates lots of data of complicated quality, we will have something that will give us a genome, for example, or a proteome. And then instead of spending 80% of our time cleaning data, we would spend 5% of our time cleaning data and 95% of our time solving real problems.
What's like in your experiences a real problem you think we're close to solving and this could help?
Oh, many problems. I think for me, one of the most interesting is when you have complex gene interactions. So, for example, obesity, or which is not a very obvious problem in genetic terms. You know, we know a few things, but how genes interact, I think, as we are able to be less concerned with data quality and big data and more with real data, we'll be able to do better quality statistic analysis to find which genes are involved in that, for example. And if we spend less time doing data cleanup, we'll be able to address problems like those, which in those cases where we have lots of gene interactions, but we don't. It's not exactly like lactase tolerance, where there is one gene. Actually, there is more, but if you are a Northern European, there is one gene, and if you know that
That's me.
one, okay, it's
Mhm.
something substantially more complicated than that. And for those cases, we need actually less data and more signal. And I think in the next few years we'll be going in that direction.
But it will be for therapies, right? So because I feel like our industry, the life sciences industry, it's headed in a direction of personalized medicine. And
Yes.
isn't this counterproductive to what big pharma wants? I mean, this whole 100 years plus has been symptom treatment, but not curing the problem. And this is paradigm shift because it's going straight for the problem.
Yes, I think yes. That discussion could take us very far away. The economics of pharmaceutical companies, etc.
Well, the reason I ask is because do you think that's going to be a stopping force to this?
Uh, no, not forcefully. The idea that you can tailor therapies to individuals, that doesn't have to be. I don't believe. I think these are orthogonal problems,
Hmm.
yeah, I think these are orthogonal problems. They are. I don't think they are related. The whole economics of pharmaceuticals.
It's
Uh,
going to change. I mean,
yes.
one of the two has to change. I know they're working right now. The industry's pushing mRNA, monoclonal antibodies, CRISPR, gene
Mhm.
therapy, and then a bunch of the pro drugs, like Chris brought up earlier, repurposed generic that are off patent,
Mhm.
repurpose. They did one for ADHD just recently.
Mhm.
Um, they're doing one for ibuprofen, repurposing acetaminophen for all kinds of things. So I think that's a big driver too. But I think in the long run, we all get to this place that nobody knows like the ramifications of what that's going to do for drug companies. They're going to essentially be tech companies.
You see that already. Absolutely.
So we're back to my theory of we're in the matrix. Every problem's tech.
Yes, from that perspective, I think you're right, actually. Yes, I think drug companies are becoming more and more tech companies. Absolutely. So from that perspective, yes, absolutely.
Yeah. See, this is just we can talk forever about this. So like what was your first interest? Was it you were computer first, right? Computer science is first.
I was
Then
interested
you went
in poverty diseases, in malaria.
malaria. You want to
Yes.
talk a little bit about that? Can I tell you what terrifies me?
Uh-huh.
I just read a book from the 90s, but I read it about Ebola, the true story of Ebola,
Uh-huh.
and how the United States in the 80s almost had a pandemic. It would have been nothing like coronavirus. I
Is
mean,
that is the name of the
9
book
out of
Red
10, 9 out of 10 would have died. The name of the book, it's outside. I'm almost done with it.
Red Zone?
Red Zone. Hot Zone. Hot Zone.
Hot Zone. Yeah, I read the same
Yeah.
book. Yeah, good book.
Terrifying.
Yeah, good book.
And it's not fiction. I mean, that's the
Yeah.
worst part. So as somebody who studies viruses and specifically for poverty, I mean this affects everyone, but what are your thoughts on that?
So Ebola. So I'm not a specialist on Ebola
Yeah.
in any way, sort of fashion, but the thing with diseases that explode very fast and that transmit very fast is that and 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 that have brutal outcomes, which is the case of Ebola. They tend to be easier to contain because it's not that you have a disease and you get on a plane and a few days later it shows up. It will show up immediately, so you'll be contained immediately.
Hmm.
And so it's horrible for whoever gets the disease. I don't think it will be diseases. That specific case is problematic. The exact opposite would be HIV, which can take years to show itself, right? So something that it has immediately very negative consequences. It's normally easier to contain, I would
Do
say.
you think that this mRNA technology, I mean, what are your thoughts on this? It's kind of a polarizing platform, but what do you think about the technology itself?
Uh, I would like to see substantially more studies about the long term consequences of many of these technologies. I think many of them are very interesting, but we need longer term and less emergency approaches because uh, with uh, with pharmacological interventions, we know that the long term consequences need to be studied. So
Yeah.
I would like to see more long term studies about many of these technologies.
How do you think, as a somebody who's trained across multitude of different educational studies, do you think the response of vaccine mandates was appropriate?
I prefer to avoid commenting on politics as
But
a rule.
as a scientist, do you think?
I think the two things are orthogonal. So
Mm,
I think the political decisions should be informed by science, but they are political decisions,
mhm.
and they should be seen as political decisions
Yeah.
and not. Uh, I don't think science has anything to say about mandates. That is a
Mm,
political decision. We should use the best information, and then there should be decisions about that. I I have my own perspective, but I think it's better if I keep it to myself because I think we should separate factual discussions from how do we then address societal issues,
mhm.
which is essentially the realm of politics, in my opinion.
Fair answer.
And
Yeah, I think it's well
you
said.
right? I think people should be should do what should have whatever their opinions, and I don't want to. I don't want to contaminate factual, let's call it factual factual issues with opinions.
Yeah, I know, but we live in a world where all these things are intersecting, and we still live. We all live on this planet and have to abide by what's happening. So
Oh,
I just,
absolutely. I do have my opinions. It's just that
Mhm.
I think it's better if if we separate things
Yeah.
when so that whatever I say technically is not influenced by whatever I think politically, and people can separate those two things. And I prefer to separate them.
Yeah, it's very tough to do that though. I know because I don't honestly, my opinion has always been I'm not sure, but if it's a brand new technology, I don't know if it's the best idea to do a beta test on everybody. It's like everyone's in a clinical trial basically, because we don't know the long-term effects. Normally in a clinical trial, you do an informed consent. You know, y- we know
Yeah,
how studies are.
I would prefer. I think more time would be better.
But their hands were tied also. Like somebody told me like, well, what else were they supposed to do? People were not going to work. The economy was shut down. Like that's government's. If you give government a hammer, they're going to use it if they think it's going to help. So I mean, I could see both sides, but I respect that your answer. I give you that. I give you that answer. We allow. Chris, what do you think? Chris is there, very quiet. You want to move back to Python, or where we all more comfortable, or you want to continue to exploit mRNA's potential?
Well, whatever you'd like, whatever the doctor would like to discuss,
Do you
actually.
think there's Do you think the potential in mRNA as a technology is worth um, exploring? I mean, we're already
Yes.
far down the road, but
Oh,
yeah.
yes. I think absolutely. I think everything should be explored.
Hmm.
That's
I,
that I don't think that's
I was
well, almost everything should be explored. But I think mRNA technology is absolutely and exactly how we do that. Then that's another discussion. But
Are
yes,
we capable? Is the computers and programming capable right now of taking an mRNA, like creating, in theory, they say the next virus comes out, and in 3 days we can have an mRNA to program. So, do you think the computer systems are advanced enough to run simulations on this right now to see what the possible outcomes would be?
there are two things. One is the genetic design, and there maybe yes. With regards to doing epidemiological modeling,
Mm,
I think that there is too much hubris on that. I think there are lots of unknown unknowns. So I think the design, the genetic design, I think yes. I,
mhm.
again, not exactly my specialty. I'm close, but not close enough.
You're closer than in the land of the blind. He with one eye is king.
That's right. I was just reading a story yesterday, an article yesterday that they're they're releasing or they're starting a study on mRNA for recent patients who've had a heart attack, and it'll regenerate tissue and heart muscle. So that's a fascinating study. Um, you think there's anything there
That's
potentially?
that's completely outside my comfort zone.
Okay,
The only thing
fair
I can
enough. Fair
say,
enough.
I hope it works.
Yeah, absolutely, absolutely.
This mRNA thing is really, I mean, the potential's there, but like you said, there's so many unknown unknowns. And what we do know, like, so you're saying the computer system right now, as you know it, in theory, if we create a mRNA tomorrow, you will be able to tell relatively quickly what it does to the DNA, to the
No,
genome,
no, no,
right?
no.
You won't.
What I'm just saying is that if you have the if you have the RNA of a virus, you can easily look at a part of it and design something
Uh,
related to it. As far as I go, the implications on the human body, I think we are far. The
I see.
long-term implications, I think we need to rely more on old-fashioned clinical trials, long-term
Yeah, I agree.
evaluation, excuse me,
I agree.
evaluation. What I'm just saying is, if you have a sequence of say a spike protein, you can easily get the messenger RNA. That's not even a complicated issue. The downstream effects, I think we need to rely on old-fashioned uh,
Yeah.
clinical trials, etc.
Well, they're working simultaneously. They're working on in silico clinical trials. I don't know if you're.
Yeah, I think that's interesting, but I think that never it's a bit like the all the issues with model species like mice or something. It's interesting. Both things are interesting. There are interesting perspectives, but we need. I think we need. In that respect, I'm very old-fashioned. I think we need to do
Mhm.
standard clinical trials.
No,
Wait,
yeah, definitely. I mean, I think that, yeah, I respect your opinion on a lot of things. I like how you can separate science and from opinion because most people can't. I mean, if you're on Twitter,
oh
you
yes,
know, the two are intertwined. You get either one
yes.
camp or one camp. That's it. Anti-vax, vax. I think it's kind of stupid.
Yeah, I think we should be able to have a civilized discussion about how things work, etc. And
Not
then,
possible. Not possible. I think that is beyond our expertise. With this book, actually, The Fourth Turning, talks about these kind of things. We're in a
yeah, I
state of
know
chaos
it's one
now.
of my favorite books.
Really?
Yes.
Yeah. I have it on Kindle, but I bought the original because somebody else in the
Mhm,
office wanted one, so I got a hard copy
mhm.
for me as well.
I did the opposite. I first buy the original, then I bought it on Kindle. It's
Okay, yeah. Chris also likes that book, so we're kind of on, similar, like the zeitgeist of our
Mhm.
society. Um,
Winter
is
is here, right?
Yeah, winter is basically here. I mean, it's interesting how if we are able to keep science separate, because we've already seen it's just the beginning, right? I don't know. That's a dystopian viewpoint, but eventually we'll get to the good times too. You just need to wait 20 more years.
Yes.
You gotta wait 20 years. Uh, Chris, you're mighty quiet down there. What do you think, man? What's going on in your head?
So, what kind of music do you like?
Ah, taking away left field.
I like a lot of different uh, kinds of music. It's very difficult for me to. It depends on my mood.
Okay,
What's
your
your mood
mood.
right now? For
Yes,
me
I
and
was going to
Chris,
say mood today.
The mood today is positive,
I like it. Positive.
but
We always end the
We
podcast with the guest. The guest picks a song, and then we play it here on the video.
okay.
That
So
one that you think we never heard that you
oh,
like,
I
and
can
so
I can think of plenty. Yes.
so before you go any further with the positive, you're in a positive mood today. So are you a contrarian like Dan, in which positive mood means it's time to listen to more depressing music?
yeah, I am this way.
Oh no. In terms of music, if I'm positive and I like to listen to cheery things.
Yeah,
Mm.
positive music.
Yes.
I'm the same way. You
You're
and I are.
normal. You guys are normal people.
Dan's a contrarian. Yeah, I want the opposite.
Yeah, if I'm positive, I need to listen depressed and vice versa.
So I do like, so a director, Hayao Miyazaki. That's the
No,
name.
but we're happy to find it. How
Uh, he,
I
he did a lot. He's Japanese. He's still alive. And another is Takeshi Kitan. So they are Japanese, and they normally they work with a composer called Zoe Hisaishi. And you probably seen films of the first one, especially if you have kids.
Look
Um,
at Chris. We're
uh,
big in Japan. When we did that heavy metal band,
Baby metal.
Baby Metal, that was big time. So our Japanese audience, you're Dr. Antao, you are making them happy. So who is it that I search?
let me put on. They give me a second to put it on the chat.
Okay. because I will search it and I will play. It's been fascinating discussion. I mean, there's probably what 100 people in the world that might actually understand your book, or you think
There are
there's more?
more. There are more.
200?
Probably 20,000 more.
20,000. Okay, while you're searching for the song, what are you doing at University of Montana? Like, how do you even get invited to do this kind of stuff? What?
So I was also interested in conservation genetics. The University of Montana has an amazing group
Mm,
there, and so they invited me to join them a few years
conservation
ago.
genetics.
Yes,
Interesting. Can you
they are
explain, like,
really.
to dumb people what that means?
So it's essentially so the US has laws, very good laws with regards to protection of of species under threat, and
Okay.
it's actually based on genetics a lot. And it's not uncommon for example, judges to ask what is the loss of diversity in genetic terms before they make a decision, because the Endangered Species Act is related to that. And so there is a lot of good work done in that regard to, for example, study, imagine, say, salmon, okay?
Mhm.
Do we have enough diversity to maintain a population to feed people, or say bison? If we lose a certain amount of bison, do we risk the population? There is, and that's genetics also, and there is very good work being done about that, and I had the privilege of being involved with that,
Mm,
and
wow.
that was my work at the University of Montana, which is it's really good. You would expect it. It's in Montana. You wouldn't expect New York City to be especially a place with people working in that area, but Montana obviously
Hmm.
they have a very good group doing that.
You should get your own podcast. You know, I don't know if you.
I do. Unfortunately, the time and the
I
discipline
know.
that you have, I don't have. Uh,
Well, you have way more discipline than me. Let's just put like, let's be frank. I mean, this to code. Chris also. You know, discipline's not necessarily my strong suit. Um, but yeah, we can do this song. Uh,
Well,
we
we have the I don't know if he's a composer, but the
he's a
musician.
composer,
Oh,
and
you put it in the chat here. Okay.
let me find
I
the.
got it. I got it.
He,
I'll find the
yes,
best one of this guy. Guy, right? Joe?
well,
Yes,
doc,
Safe to
maybe
assume.
maybe Doctor Antal has one that he wants us to listen to.
Okay, so I'm gonna search
choose
him
your
on
account.
YouTube. I'm getting one that's 1 hour. I don't think you guys want to be here that long. 2 hours. I
Oh
definitely don't
wow!
think so. Here's one. One summer's day. One summer's day. It's got 12 million views.
Okay, fantastic.
All right, here we go.
Is that a positive one?
I think
Better be
well, most
after
most
all
of the
this.
musics they are for movies for kids, so
Oh, okay.
not all, but most are. So they normally are
Man,
positive.
only 4 minutes. So here we go. One summer's day. We could pause if you guys want to pause during the song to say something to highlight something. Just start talking, and we can do it. Here we go. Let us know if you can hear it. Can you hear the piano?
Mhm.
Yep.
Okay. I feel smarter already. Just first few keynotes. Could tell why you wrote that book. Sorry to pause. This guy, what he's doing, did you know that they have this, speaking of the Matrix, they have this glove. They made a glove. I forgot what it's called, but I just read about it. It's a glove. If you wear it stimulates like your fingers on a piano, So like throughout the day, you're just memorizing this pattern with your fingers.
Mm-hmm.
So then when you sit in front of a piano, if you know where to start, your hands just play like automatically. So you
Uh,
can learn like in a day how to play any song and impress the hell out of people.
I,
So the gloves are teaching you how to play a song.
Yeah, they're programming your fingers.
I'm very old-fashioned with regards to that. If you want to learn music, get an instrument and
Yeah, but you're a programmer. This is what they're doing.
yeah,
Programming.
I prefer more natural ways of going around.
Yeah, I agree. But they actually have applications for stroke recovery.
Uh-huh. I suppose so. And for surgery, where you have feedback and stuff like that. Yes.
Yeah. It's actually a medical company. I forgot the name, but this reminded me of that.
I'm pretty sure this is for a movie for kids.
This
Uh,
one?
yeah, I'm pretty sure. I bet.
Okay. Chris would know all those.
Well, if they're Disney.
No, no, this is One Summer's Day. Let me just see if I can find it.
So getting back to your gloves real quick, Dan.
Yeah.
So it's not a whole lot different than Beethoven, though, right? I mean, because he would stand there and put his hand on the piano and you'd play the keys.
Yeah, but this is like passive. So you just wear the gloves, you do your day, like whatever you're
Sure.
doing, and your fingers, your brain is memorizing the pattern.
Right, of course. Of course. You're
Multitasking.
sure. But
Somebody's programming your brain.
what I'm
Program.
saying is it's coming through in vibration like it would be to Beethoven. The
Mhm.
difference here is you're not creating music. Beethoven was.
Mimicking.
You're regurgitating.
Yeah. That leads to a deeper philosophical debate on the difference between creating and executing. Um,
Sure.
but yeah, this you guys are way too smart for me.
Well, he's going to tell me what the movies
Oh,
were.
my bad.
Spirited Away. Spirited Away. Let me.
Yeah, I don't think I've seen that.
It's not American, I'm guessing.
It's Japanese. Yeah.
Ah, there you go, Chris. You gotta explore new horizons, man.
But it was very popular here.
Hey,
These movies are very popular in all across the world.
don't give me that. I've watched two Japanese cartoons, Pikachu and Star Blazers. Star Blazers. I think it was Star Blazers.
I'll just chuckle like Dr. Antal. This guy's amazing, man. I gotta pause because we can't let this opportunity go to waste. The Japanese, they're gonna come in waves now. Watching this, they support their artists like no other almost. So now is the perfect time because we do one of the reasons we do these is we make this just a song, mini video, because people have ADD, and it's a gateway. It's a Trojan horse to the long interview. So I was going to ask you, Dr. Antal, using this song as a Trojan horse. See, we are programming viewers' mind we've never even seen to watch the longer interview. Is this like a potential career? There's a lot of medical innovation in Japan. Are there a lot of your core audience in Japan?
I think so. Yes, actually, I know readers of the previous editions of the book that are from Japan. Yes.
There you go. I had to get that out there for you. So, guys, if you're watching just the music, a rapper said the dumb are mostly intrigued by the drum, but you want to go watch the whole thing with Dr. Antal. It's amazing.
Well, love the piano. Love the piano. I don't know which is my favorite, that or guitar. Similar instruments. So they say if you can play one, you can play the other.
I can play neither, unfortunately.
Yeah, me neither.
Well, that's amazing. So thank you guys so much, Dr. Antal. I know you gotta go. I'm gonna put your LinkedIn profile underneath. I think everybody needs to go connect. I just went to go connect with you. Chris doesn't have a LinkedIn, so his loss. But
I have
everyone
a
else
LinkedIn.
watching, okay, Chris, then
I
you
just don't
connect
use it.
also. Okay, same difference. That's only knowledge is only potential power. Okay, so you have
Yep.
to actually use it. But Dr. Antal, thank you very much for coming
It was
on,
a pleasure. Thank you both.
Yep. Thank you very
talking
much.
to us and educating us about how much we don't know. Actually, so
Very,
it's
very interesting stuff.
yeah, absolutely. I still think you should have a podcast one day, so think about it. But thank you very much. Thank you everybody for watching. Go follow Dr. Antal right now. Like, subscribe, comment, share. Message him on LinkedIn. Get the book if you're one of the 20,000 people in the world. Bye bye.
Thank you, everybody. Bye bye.
Thank you both. It was a pleasure.